So we had previously conducted a study called SYSTEMS, when we just looked to see whether a standard course of conventional radiotherapy was beneficial and for how many patients. And that showed that a course of 20 Gray in 5 fractions over 1 week gave clinically meaningful pain relief in only 1/3 of patients. Now, we now have much better radiotherapy techniques, much more precise, more sophisticated ways of delivering radiotherapy, so we can give higher doses without worrying so much about side effects. So we wanted to see whether a higher dose of radiotherapy would improve pain control and hopefully in a bigger proportion of patients as well. Well, the first thing to say is that we recruited 110 patients to this study. That is by far the largest randomized study of radiotherapy in mesothelioma that's ever been done. It was very challenging because these are quite frail patients, often quite close to the end of their life, sadly. So that in itself, I think, was an important achievement. We found that we were able to deliver the higher dose of radiotherapy with very little extra toxicity. In terms of the primary endpoint, so this was pain relief 5 weeks after radiotherapy, we did see a small increase in the proportion of patients who were benefiting, but that wasn't statistically significant. So that part of the study was a little bit disappointing. We're still waiting for some of the secondary endpoints. So one of them is radiological response 9 weeks after radiotherapy, and we're in the process of analysing all of those scans. But the other secondary endpoint was overall survival. And we were quite surprised to see a statistically significant improvement in overall survival in patients receiving the higher dose of radiotherapy. Now, this is early data, so we're going to continue to follow these patients up, and we're going to repeat that survival analysis in another 6 months' time. But it was unexpected and perhaps quite exciting. The hardest part was finding the patients. So they had to be at least a month after any systemic therapy, and they had to be not planned to be receiving systemic therapy for at least 6 weeks. So that made it quite tricky because some people didn't want to rule out other treatments. And often when patients have completed a course of systemic therapy, they're not in a great shape from the therapy, never mind the tumour. So it was quite hard to find the patient, so it did take quite a long time to recruit. But having said that, once patients were on the study, the delivery of the radiotherapy was pretty straightforward. Yeah. So one of the things I hope that these results are going to show to the community is that radiotherapy has a value in mesothelioma. So because of current guidelines and the lack of evidence, it's often only even considered when patients are getting towards the end of their life. And by that stage, the chances of making a meaningful improvement are already quite low. So it's not direct evidence that a more radical approach is going to be beneficial, but it supports the idea that radiotherapy has a role in this disease, and maybe we should be looking at using it earlier in the course of disease. Right, so we want to follow up and get more mature survival data. That's going to be really, really important. We're really interested in the radiological response data, so we will also have all that by the time we repeat the analysis. So I think taking them all together with the pain data as well will be very informative. We're doing some quite exciting translational work. So if we look at the survival curves, it's apparent that about half of the patients are not really benefiting from that higher dose of radiotherapy. So the survival curves are pretty close together for the first half, but then they separate quite strikingly. And so it seems that there's about half of patients who are, for whatever reason, going to benefit from this higher dose. So if we can identify who they are, then we can perhaps be give more intensive or earlier treatment with radiotherapy. So we're doing some radiological studies and we're doing some tissue-based studies to try and find some biomarkers. In terms of SYSTEMS-2, there's already a trial in development to test radiotherapy up front for mesothelioma. which I'm really pleased about. It's going to involve protons, because that is possibly even more successful at sparing the healthy tissues and treating these complex volumes. So that's in development, so I'm really pleased about that. Another area of interest for our lab is combining molecular targeted drugs with radiotherapy in mesothelioma. So we're looking to see if we can improve response rates beyond what we're seeing with SYSTEMS-2.